You're standing in the grocery store checkout line. The pressure starts. Faint at first, just a whisper. You try to ignore it, but within seconds, it becomes a desperate urge. You're not going to make it to the bathroom in time. Or worse, you laugh at a joke, you sneeze, you lift something heavy, and you feel it, that warm wetness, that leak you couldn't control, and the shame that comes with it is devastating. Millions of men over 60 live with urinary incontinence and urgency, and most suffer in silence because they believe it's just part of getting older, that there's nothing they can do. But here's the truth nobody is telling you. Incontinence is not normal, it's not inevitable, and in most cases, it's completely treatable. Over the next 15 minutes, I'm going to show you exactly what causes incontinence and urgency in men over 60, why Kegel exercises work for up to 75% of men when done correctly, and the complete protocol to regain bladder control starting today. My name is Dr. Jane. I'm a physician specializing in male urological health with 18 years of clinical practice focused on men over 60. Before we get to the solutions, you need to understand one thing. Incontinence is not a single disease, it's a symptom. And there are 3 fundamentally different types. The treatment for each is different, and what helps one type may do nothing for another. Type 1. Urgency incontinence. This is the sudden, desperate sensation that you need to urinate now, not in 5 minutes, now, and if you don't get to a bathroom immediately, you're going to leak. This type is often linked to a condition called overactive bladder. The bladder contracts involuntarily, even when it's not full, and in men over 60, the number 1 cause is enlarged prostate. The enlarged prostate compresses the urethra, irritates the bladder, and creates false urgency signals. Your brain thinks the bladder is full when there's actually only 50 or 100 milliliters in there. Type 2. Stress incontinence. This is leaking with coughing, sneezing, laughing, lifting weights, or any increase in abdominal pressure. In men, this is less common than in women, but it happens, especially after prostate surgery, radical prostatectomy for cancer, or surgery for benign enlargement. The cause is weakening of the urethral sphincter or the pelvic floor, the muscles that keep urine inside. Type 3. Overflow incontinence. This type is insidious. You feel the urge to urinate, go to the bathroom, and almost nothing comes out, or it comes out very slowly, in a dribble, and then, 20 minutes later, you leak without warning. Because your bladder never emptied completely, it's constantly full beyond capacity, and urine simply overflows. The most common cause? Severely enlarged prostate blocking the urethra almost completely. Identified your type? Keep it in mind. Now I want to tell you about one of my patients. I'll call him David. 67 years old, retired, former amateur baseball player, strong man, proud, independent. He walked into my office with his eyes down. He couldn't look me in the eye. Doctor, I'm leaking. I can't hold it. It happened at the gym last week. I was lifting weights and everyone saw. I pretended it was sweat, but it wasn't. His timeline, it started with urgency. He had to rush to the bathroom several times a day. He ignored it. Then he started leaking at night, waking up with wet sheets. He stopped drinking water after 4 p.m. It didn't help. Then came stress leakage, any physical exertion, any strong laugh. He stopped going to the gym, stopped going out with friends. His social life collapsed. When David sat in front of me, he was wearing absorbent pads every single day, and he was too ashamed to tell his wife how much this was affecting him. I looked at his lab work. PSA slightly elevated. Ultrasound showed prostate at 58 grams, almost double the normal size. Post-void residual of 180 mEU. His bladder wasn't emptying. He had mixed incontinence, urgency from enlarged prostate plus stress from weakened pelvic floor. And here's what most men don't know. This is treatable, completely treatable. Let's talk about the solution that works for up to 75% of men when done correctly. And most men have never even tried it because nobody explained how to do it. Kegel exercises. Now, I know what you're thinking. Doctor, Kegels are for women. Wrong, completely wrong. Dr. Arnold Kegel developed these exercises in 1948 specifically to strengthen the pelvic floor. And men have a pelvic floor. Men have the same muscles that control the urethra, that stop the flow of urine, that maintain continence. And when these muscles weaken, through age, through surgery, through inactivity, you lose control. Here's the problem. 90% of men who tried Kegels did them wrong. They squeeze their buttocks, they contract their abdomen, they hold their breath. And that does absolutely nothing. Here's how to do them correctly. Imagine you're trying to stop the flow of urine midstream, or imagine you're trying to prevent passing gas. You'll feel a deep contraction in the region between your scrotum and anus, the perineum. This contraction should be internal. Your buttocks should remain relaxed. Your abdomen should remain relaxed. Your breathing should continue normally. Contract. Hold for 3 seconds. Release completely for 3 seconds. Repeat. A 2019 study published in the Journal of Urology followed 312 men over 60 with post-prostatectomy incontinence. Those who did Kegels correctly, 3 times a day, 10 to 20 repetitions, for 12 weeks, had 73% improvement in continence. 73%. Another 2021 study in the British Journal of Urology showed that men with urgency incontinence who combined Kegels with bladder training had 68% reduction in leakage episodes. But here's the key: consistency. It doesn't work if you do it once and stop. It doesn't work if you do it wrong, and it doesn't work in 1 week. You need 6 to 12 weeks of daily practice to see real results. David started Kegels under the guidance of a pelvic floor physiotherapist. Yes, these professionals exist and specialize in this. 3 times a day, 15 repetitions in the morning, 15 in the afternoon, 15 in the evening. Each contraction for 3 seconds, followed by complete relaxation for 3 seconds. Within 4 weeks, he noticed a difference. Leaking when coughing reduced. Urgency became less intense. Within 3 months, he stopped using pads completely. He went back to the gym. He went back to going out with friends. And he cried in my office when he told me, "Doctor, I thought I'd lost my dignity forever." Before I reveal the rest of the protocol, the other solutions that work beyond Kegels, do one thing for me. If you recognize at least one of these symptoms in your own life, leave a like right now. And in the comments tell me, have you tried Kegels? Did they work or not? I want to know. Now, let me be honest with you the same way I am with every patient. Kegels are fundamental. Lifestyle changes are fundamental. But in men over 60, incontinence and urgency often have a root cause that exercise alone doesn't resolve: inflamed and enlarged prostate. The enlarged prostate compresses the urethra, irritates the bladder, creates false urgency, and blocks complete emptying. And as long as the prostate remains enlarged and inflamed, you're fighting against the tide. The prostate needs specific nutritional support that you simply can't get through diet, even if you're eating perfectly. I've left a link in the description for a natural formula developed specifically for the prostate. Over 20 clinically researched ingredients, including saw palmetto that reduces DHT and improves urinary flow, pygeum that reduces prostatic inflammation and urinary symptoms, and green tea extract rich in antioxidants that protect prostate cells. All of this working on the same pathways we discussed: DHT reduction, inflammation control, flow improvement, no prescription needed, full 180-day money-back guarantee. If you're tired of leaking, tired of running to the bathroom, tired of wearing pads, and you're ready to actually do something about it, that link is in the description. Takes 60 seconds, and the only thing you lose is another 6 months of shame and isolation. Now let's get to the rest of the protocol. Beyond Kegels and prostate support, here are the other tools that work. Lifestyle changes. First, cut caffeine and alcohol. Both are bladder irritants and diuretics. They fill your bladder faster and create artificial urgency. A 2020 study showed that men who eliminated caffeine after 2 p.m. had 41% reduction in nighttime urgency episodes. Second, lose weight if you're overweight. Every extra 10 pounds increases abdominal pressure on the bladder. Obesity is an independent risk factor for incontinence. Third, stop smoking. Smoking causes chronic cough, which weakens the pelvic floor over time. Bladder training. This means retraining your bladder to hold for longer periods. If you're going to the bathroom every hour out of fear of leaking, you're training your bladder to signal urgency prematurely. The protocol: go to the bathroom at scheduled intervals. Start every 90 minutes, regardless of whether you feel urgency. Gradually increase to 2 hours, then 2.5 hours, then 3 hours. When you feel urgency before the scheduled time, take a deep breath, do a quick Kegel contraction, and wait for the urgency to pass. It will pass. In 8 to 12 weeks, you've retrained your bladder. Medications. For severe urgency incontinence that doesn't respond to Kegels and lifestyle changes, there are medications. Anticholinergics like oxybutynin or tolterodine relax the overactive bladder. Beta-3 agonists like mirabegron do the same through a different pathway. Side effects can include dry mouth and constipation, but for many men, the improvement in quality of life is worth it. Devices and procedures. For severe stress incontinence post-surgery, there are artificial urinary sphincters, surgically implanted devices that function as a controllable valve. Success rate, over 85% for post-prostatectomy incontinence. There are also male urethral slings, surgical meshes that support the urethra. These are last-line options, but they are options. Here's the complete protocol to regain bladder control. Weeks 1 to 2, start Kegels, 3 times a day, 10 to 15 repetitions. Focus on correct technique, internal contraction, relaxed buttocks, normal breathing. Weeks 3 to 4, continue Kegels. Add bladder training. Go to the bathroom at scheduled times, not when you feel urgency. Weeks 5 to 8, continue everything above. Eliminate caffeine after 2 p.m. Eliminate alcohol in the evening. Add prostate support if enlarged prostate is a factor. Weeks 9 to 12, continue all habits. Increase Kegels to 20 repetitions 3 times a day. Gradually increase bladder intervals. What to expect? Weeks 1 to 2, you may not feel anything yet. That's normal. You're building muscle strength. Weeks 3 to 4, urgency starts to decrease slightly. Leaking with coughing may reduce. Weeks 5 to 8, noticeable improvement. Fewer leakage episodes, more control. Weeks 9 to 12, continence significantly improved. Many men stop using pads completely. Mistakes to avoid: don't do Kegels wrong. If you're not sure you're doing them correctly, see a pelvic floor physiotherapist. Don't give up before 8 weeks. Muscles take time to strengthen. Don't ignore enlarged prostate. If you have high post-void residual, elevated PSA, or weak flow, treat the prostate too. Don't be ashamed to seek help. This is treatable. David today lives without pads. He goes back to the gym 4 times a week. He went on a cruise with his wife last month, something he had cancelled out of fear of leaking in public. He told me, "Doctor, I thought my life was over. Now I know I just needed the right tools." You just received those tools. Kegels work, up to 75% effectiveness when done correctly and consistently. Lifestyle changes work, prostate support works, bladder training works. The question now isn't whether it works. Science has already answered that. The question is, will you implement it, or will you keep living with shame, pads, and isolation for the next 5, 10, 15 years? Because here's the hard truth. Incontinence doesn't improve on its own. It progressively worsens unless you intervene. This protocol is your intervention. And if you want to add prostate support, that formula with over 20 ingredients I mentioned, the link is in the description. Saw palmetto, pyjum, green tea extract. Full 180-day guarantee. No prescription needed. Now share this video with another man over 60 who's suffering with this. Subscribe to the channel and leave in the comments, have you tried Kegels? Did they work for you? The responsibility is now yours.